Student, good day. And now we start our lectures. Today we talk about two topics of lectures. The first topic is virulent infection and sepsis in surgical patient, and second topic is tumor. Now we begin the first topic, virulent infection and sepsis in surgical patients. Student, sepsis is very dangerous disease, and now I give you some information of this disease. Now, for example, each year at least 1.7 million adults in America developed sepsis, and nearly 270,000 die as a result. The number of sepsis cases per year has been on the rise in the United States. And other information for the sepsis in England. Sepsis incidence in England of episodes per year as reported by the Health and Social Care Information Centers. And in this table you can see the increase number of these patients every year. Now, for example, 10-11 years, we can see the 91,000, 11-12 years, 101,000, and other. You can see the increase the number of this incidence of these patients, and 17, 18 years, you can see the 200,000 patients. And next information is having mortality in Northern Islands to be similar to that is Wales at 24%, and accepting the figure from the other countries at face value. It seems responsible. It seems reasonable to propose that this year we will have seen a total of up to 52,000 deaths. Even if we applied Scotland 20% mortality rate across the ultra-conservative estimate of 230,000 cases derived from the raw coded data, we still arrive at just over the 46,000 deaths. Thus, it seems highly likely that across the United Kingdom, sepsis claim as many as 52,000 lives per year. To put this into context, Cancer Research United Kingdom reports to have been 11,000 deaths from breast cancer and 11,000 from prostate cancer and 15,000 deaths from bowel cancer in 2014. There were 35 deaths from lung cancer in same periods. As you can see, the mortality numbers of sepsis is more. Student, despite the widespread in medical practice and powerful antibiotics and chemotherapy drugs, therapeutic drugs, are currently in the NECU development countries of Europe and the United States, at least 30% of all cases of diagnosed sepsis, inevitable fatal. Severe sepsis and septic shock are most common causes of death in surgical patients, and mortality rate in extremely severe form of sepsis, sepsis shock, remains the most high. Obviously, the easiest way to distinguish between types of sepsis on the basis of the nature of its causative agents, etiological classification. And the first, the sepsis which is caused by bacterial infection. This is called as a sepsis polybacterial nature. Sepsis caused by low fungi, fungal sepsis, and sepsis with bacterial and fungal etiology, a mixed sepsis. Viral sepsis, sepsis caused by virus and occurring with the symptoms of generalized viremia. The share of bacteria account for more than 95% of cases. The most widely disturbed species of sepsis, which are caused by conditionally pathogenic microorganisms, are aerobes, gram-positive and gram-negative staph, staphylococcus, streptococcus, colibacillus, pseudomonas sepsis, and variants of sepsis caused by microorganisms anaerobes. Agents of sepsis can also be completely pathogens. Mycobacterium, meningococcus, bronchomyxin, and plaque sepsis. Gram-negative sepsis is clinically more severe. During this type of sepsis is recorded more often signs of septicopemia. Of septicopemia, panicky with multiply secondary photo often develops in septic shock, significantly higher fatality rates. Students, this is very interesting information for you. After removal of spleen for any reason, there is a predisposition to sepsis condition, often meningococcal and pneumococcal etiology. This spleen is able to englobe to associated with antibodies, bacteria and encapsulated bacteria, especially pneumococcus and meningococcus. While in this liver are destroyed only well-positioned bacteria. In order that the liver took on the function of the destruction and encapsulated bacteria after removal of the spleen, it is necessary to introduce a large amount of fresh plasma containing opposins. Finally, the spleen is produced many immunoglobulin M, The drawback of all these factors contributes to the development of a fatal syndrome post-splenectomy. Sepsis. Sepsis have different forms, and more often this may be sepsis, simple sepsis, severe sepsis, and septic shock are inflammatory states condition result from the systemic response to bacterial infection. In severe sepsis and septic shock, there is critical reduction in tissue perfusion. Symptoms often begin with shaking, chills, and include fever, hypotension, oliguria, and confusion. Acute failure of multiple organs, including the lung, kidneys, and liver. It can occur. Symptoms and signs. With sepsis, the patient typically has fever, tachycardia, tachypnoea, and blood pressure remains normal. As severe sepsis or septic shock develops, the first signs may be confusion. Blood pressure generally falls, yet the skin is paradoxically warm. Oliguria, the daily urine less than 0.5 milliliters per kilogram per hour is likely to be present later. Extremities become cool and pale with peripheral cyanosis. And organ failure causes additional symptoms and signs specific to organs involved. Sepsis is infection accompanied by acute inflammatory reaction with systemic manifestation associated with a release into the bloodstream of numerous endogenous mediators of inflammation. Acute pancreatitis and major trauma, including bones, may manifest with signs of sepsis. The inflammatory reaction typically manifests with two signs of the following, but it's 4 signs. And now all the 4 signs, I talk about this. The first sign is temperature. If your patient has the temperature more than 38 degree or less 36 degree, it's positive symptoms of sepsis. Heart rate more than 19 beats per minute. Respiratory rates more than 20 beats per minute. And low the pressure of carbon gas. We will see the white blood cells. White blood cells count more than 12,000 cells per milliliters, or maybe less than 4,000 cells per milliliters. It's 4 important signs of sepsis. For a long time, The views of researchers on the pathogenesis of sepsis was characterized by polymorphism of concepts, language, and definition. Definitions of sepsis that were cited in the literature throughout the 20th century, including both characterized are equal applicable to any severe infection disease after reactivity generalization of infection, and principle incorrect. In principle incorrect, for example, the treatment of sepsis as non-infection process. This definition are out of date today, as it does not put fundamental before the physician diagnostic and therapeutic tasks. Systemic inflammatory response syndrome. Student, it's very open. It's very systemic inflammatory response syndrome. It's very important terms for sepsis. What is it? Systemic inflammatory response syndrome. Systemic inflammatory response syndrome, it's inflammatory condition affecting the whole body. It is the body response to an infectious or non-infectious insult. I also have a definition of SIRS, refers to it as an inflammatory response. It actually has pro and anti-inflammatory components. And now you can see this table for these symptoms, but this signs, I talk about the signs before this moment, and I repeat. The first important signs of response syndrome is temperature, heart rate, respiratory rate, and white blood cells. And if we find out these symptoms on patient, it's positive these syndromes. Temperature. In the first case, this temperature may be more than 38 degree, and second second case is temperature may be less than 36 degree. If you find out these symptoms on the patient, it's symptoms positive. It's symptom positive. Next symptoms: heart rate. Heart rate more than 19 per minute. It's positive. It's positive. Less than 19. It's negative symptoms. Respiratory rates. If your respiratory rates more than 20 per minute, it's positive symptoms. It's respiratory rate less than 20 per minute, it's negative symptoms. And count of white blood cells. Too, you can see if your patient has the count white blood cells less than 4,000 per milliliters, it's positive. And when the patient has more than 12,000 per milliliters, it's too positive. It's too positive. If your patient have the from 4,000 to 12,000, it's negative, the symptoms. Student, and now I talk about this human body temperature to find out the classification of temperature. What called hypothermia? Hypothermia when the patient has the temperature less than 35 degrees. Normal temperature is 36.5 degree to 37.5 degree. Fever when the patient has a temperature more than 37.5 degree or 38.3 degree. Hyperthermia, if your patient has a temperature more than 37.5 or 38.3 degree. So let's I correct. When the patient have hypothermia, when the patient have temperature more than 38.3 degree to the 40 degree, and hyperpyroxia when the patient has a more high temperature, more than 40 degree or 41 degree. And the difference between the fever and hyperthermia is the usuring mechanism. Different sources have different cutout for fever, hyperthermia and hyperpyroxia. How does sepsis show itself? All three forms of sepsis can be identified by general signs, symptoms, and biological alteration, including those sepsis specific of source of infection. And you can see on this slide this two signs: temperature, rapid breathing, rapid heartbeat, and warm skin and rash. General symptoms and general weakness. Fever. Fever is this response of high body temperature. Fever often associated with shocking chills, especially in the early phase. However, in some cases, there is no fever, and the patient may even have abnormally low body temperature, hypothermia, especially if they are young or old. Difficulty with breathing, hyperventilation, or rapid breathing. The second symptoms that may result of shortness of breath. A warm skin, sometimes associated with a skin rash, and a rapid head breath, tachycardia, and general weakness. We repeat this. Symptoms and infection site-specific signs and symptoms of sepsis. Some of the symptoms of sepsis also depend on source of infection, as shown by the following example. With lung infection, there may be a shortness of breath and all pus-like, known as virulent sputum phlegm. With urinary tract infection, the patient may have the painful of urination and smelly urine. With a central nervous system infection, like meningitis, This patient may have a severe headache, reduced tolerance to light, and stiff neck. With abdominal infection, for example, appendicitis, patient may have abdominal pain. Diagnosis. Sepsis. Sepsis may be made. Appropriated culture should be obtained from all patient sites of infection. In addition, a minimum of 2 blood cultures, of which at least one should be percutaneous and one from each vascular access site should be obtained. Sepsis is a suspect when a patient with a known infection develops system, sign of inflammation, all organs dysfunction. Similarly, a patient with otherwise unexplained signs of systemic inflammation should be evaluated for infection by history, physical examination, and tests including urine analysis, and urine culture. Serial blood culture and culture of the suspect body fluids. Blood levels of procalcitonin is elevated and in severe sepsis and may facilitate diagnosis. Next signs is hyperventilation with respiratory alkalosis. A low pressure of carbon gas occurs. And in serum, hydride carbon oxygen 3 is usually low, and serum and the blood lactate levels increase. Blood lactate levels increase. As shock progresses, metabolic acidosis worsens. Early respiratory failure led to hypoxemia with the pressure of oxygen less than 70 millimeters. Diffuse infiltrates may appear to the chest X-ray. Urea and creatinine usually increase progressively as a result of renal insufficiency. Bilirubin and transaminases may rise, else hepatic failure is uncommon. Severe sepsis. What is it, severe sepsis? Is sepsis accompanied by signs of failure of at least one organs. For example, cardiovascular failure is typically manifested by hypotension. Respiratory failure by hypoxemia. Renal failure by oliguria, and hematologic failure by coagulopathia. The definition of pathological condition associated with the sepsis adopted at the consensus conference in 1991, in Chicago. Pathological condition characteristic features. Bacteremia is the presence of viral bacteria in the blood. The syndrome of systemic reaction inflammation, SIRS syndromes, manifestate two and more signs. We talk about this: temperature, tachycardia, breath rate, and leukocytes. If you find out two and more signs, its systemic reaction is positive. What is it? Sepsis. Sepsis, syndrome of systemic reaction to inflammation plus purulent focus. If the patient has a purulent focus and the syndromes of systemic reaction to inflammation, we can make this diagnosis of sepsis. What is a severe sepsis? Severe sepsis, multiply organ failure plus hypovolemia plus hypoperfusion. It's severe sepsis. Septic shock. Septic shock, it's hypovolemia, hypotension, oliguria, acidosis, disturbance of consequences. A syndrome of multi-organs failure without treatment, the function of organs cannot be sustained. A clinical image of the one set may be repeated with spectacular chills, pyrexia, myalgia, hemorrhagic of all popular rash, on gradual with slowly growing intoxication and gradual increase in the body temperature. Too frequent but non-specific signs of sepsis include enlarged spleen and liver, expressed sweating after fever, severe weakness, hypodynamia, anorexia, constipation. In this absence of antibiotic therapy sepsis, usually and in this from multiply violation of all organs and system. Student, and now you can see the additional signs of sepsis. As the first pictures, you can see the hemorrhagic rash on on the skin, and enlargement of the liver and spleen. You can see the enlarger of the spleen in here, and ultrasounds research enlargement of the liver and spleen. This is important signs of the sepsis. And in this slide you can see how to can see this rash on the skin, hemorrhagic rash. When the pressure on the skin, on the glass, you can see this rash. It's hemorrhagic rash. And this, you can see the hemorrhagic rash. Так. Okay, student, and now we continue other topic, and other topic it's tumor. Student, tumor, also known as a neoplasm, is an abnormal mass of tissue that may be solid and fluid-filled. Types of tumor. In general, tumors are divided into three groups. The first group is benign tumor. They are not cancerous and cannot spread. A benign tumor will remain in its current forms. They do not generally return after being removed. Next, second groups, premalignant. A premalignant tumor is not yet cancerous, but appears to be developing the property of cancer. And malignant tumors are cancerous. They can grow, spread, and get worse. What difference between the benign and malignant tumors? It's four difference, and in this table you can see this difference. No, the first criteria, differentiation of the cells. Benign tumor have the well differentiated cells resemble normal cells, but malignant tumor variable differentiation from the well differentiated to the undifferentiated aplastic cells. Next science difference between this benign and malignant tumor, the rate of growth. Benign tumors have the slow growth, and mitotic figure are rare and normal. Malignant tumors, erratic, can be slow or fast. And mitotic figure are numerous and can be abnormal. Local invasion. Expansal bordered, well circumscribed tumor. Tumor often has the capsula. It's a benign tumor. But malignant tumor, hard to circumscribe, infiltrate border, usually no capsula. And difference for metastasis. Benign tumor have not metastasis, never have metastasis. And malignant tumor frequently have metastasis. It's difference between the benign tumor and malignant tumor. No, for example, in this slide you can see the tumor of uterine. And this slide you can see the different type of tumor. No, for example, benign tumor, leiomyoma, and maybe malignant leiomyosarcoma. Type of the growth of tumor, expansive growth, and infiltration growth. Expansive growth have the capsula around the tumor. Infiltration growth have not capsula around the tumor. Most benign tumors are not harmful to human health. However, even thought they are not cancerous. Some may press against nerves, all blood vessels, and cause pain, all other negative effects. Benign tumors of endocrine tissue may result in the excessive production of some hormones. And thus you can see the benign tumor of kidney. Next type of benign tumor is adenomas. Adenomas are tumors that arise from glandular epithelium tissue. The thin membrane that covers gland organs and other structure in the body. A polyp in the colon is type of adenoma. Other examples: parathyroid adenoma, eosinophilic adenoma, basophilic adenoma, bile duct adenoma, chromophobe adenoma, fibra adenoma, and hepatic adenoma. Adenomas do not start cancers. However, they can change and become cancerous, taking the form of adenocarcinomas. Wart. It's a benign tumor of the skin. And on these cells you can see these forms of these warts. It's benign tumor. It's benign tumor. Fibroids and fibromas. Fibroids are benign tumors that can grow on the fibrils of connective tissue of any organs. Uterine fibroids are common and can cause vaginal bleeding, pelvic pain or discomfort, and urinary incontinence. They can be soft or hard depending on the proportion of fibrous to cells tissue. There are many types of fibroma, including angiofibroma, dermatofibroma, and osteophying and non-osteophying fibroma. Some fibromas can cause symptoms and may require surgical removal. In rare case, fibroids can change and eventually become cancerous. In this slide, you can see the fibroma of the uterus. Fibroma of the uterus. Multiply fibroma. Here. Hemangiomas, benign tumor, hemangiomas are benign tumors that consist of excessive blood cells. They can sometimes be seen on the surface of the skin. Are known as the strawberry marks. The majority of hemangiomas appear at birth and gradually go away after some months or years. Hemangiomas do not usually require a treatment if they affect the ability of the individual to eat, hear, or see. The doctor may recommend treatment with the corticosteroids. If your patient is over 10 years of age, they are more commonly removed using laser surgery. And in this slide you can see this hemangiomas. Lipomas. Lipomas are the most common form of soft tissue tumor. They consist of fat cells. Most of them are very small, painless, and soft to the touch and generally movable. They are more common among people aged over the 40 years. Experts disagree and whether lipomas can change and become cancerous. There is a range of lipomas including angiolipoma, myelolipoma, fibrolipoma, spinal cells lipoma, hibernoma, and atypical lipoma. In this slide you can see the sample forms of lipoma. It's a benign tumor from the subcutaneous tissue, fat tissue, lipoma. Premalignant disease. This type of tumor requires close monitoring. Examples of premalignant growths include actinic keratosis, also known as senile keratosis of solar keratosis. There is this premalignant growth consisting of patches of the skin that turn crusty, scaly, and thick. Fair-skinned people are more at risk of developing these types of growth, especially those who are overexposed to sunlight. Actinic keratosis are seen as potentially premalignant because around 20% of them progress to squamous cells canceroma. Doctors usually recommend to treat this because of this. Continuous exposure to the sun increases the risk of malignancy. And this you can see the keratosis of the skin. The next premalignant disease is cervical dysplasia. This is change in the normal cells leaving the cervix. The growth can be premalignant and is at risk of development in the cervical cancer. Cervical dysplasia is diagnosed with a pap smear. It is most common in women aged 25 to 35 years and may be removed with freezing techniques or by removal of tissue from the cervix. In the slide you can see the external forms of cervical dysplasia and histology forms. Cervical dysplasia. Next, forms of premalignant tumor at metaplasia of the lung. These growths occur in the tubes that carry air from the windpipe into the lung, or bronchi. The bronchi are lined with the granular cells, which can change and become squamous. Its next premalignant type of the tumor disease is Lipoma. White patches can form on the gum, the bottom of the mouth, the inside of the cheek, and less commonly on the tongue. They cannot be scraped off easily. Experts believe smoking and chewing tobacco in the main cause. Else Lipoma is really dangerous, and small percentage can eventually become cancerous. Many mouth cancers occur near areas of Lipoma. The condition usually clear up when people quit smoking. Quitting both alcohol and tobacco together has better results. The patches can be removed using a laser, a scalpel, or cold probes that freeze the cancer cells. And third type of tumor is malignant tumor. It's very dangerous tumor. Malignant tumor divided to spread rapidly, colonizing new areas. Malignant tumors are cancerous tumors that can potentially result in death. Unlike benign tumors, malignant ones grows quickly. And can spread to new territories in progress known as metastasis. The abnormal cells that form malignant tumors multiply and faster rate. Cancer cells that metastasia and the same as the original ones. If a lung cancer spread to the liver, the cancer cells now growing in the liver and still lung cancer cells. They have, however, acquired the ability of involved other organs. Different types of malignant tumor are made up of specific type of cancer cells, including cancer of the stomach. You can see in here cancer of the stomach. In the X-ray research, and you can see inside the stomach tumor. It's large size of the tumor. And this you can see endoscopy research, and endoscopy research too. You can see this tumor of the stomach. Carcinoma. These tumors are formed from epithelial cells. For example, carcinomas can occur in the stomach, prostate, pancreas, lung, liver, colon, and breast. Many of the most common tumors are carcinomas, especially among older adults. Sarcoma. These tumors start in connective tissue, such as cartilage, bones, fat, and nerves. They originate in the cells outside the bone marrow. The majority of sarcomas are malignant. Germ cells tumor. It's other type of malignant tumor. There is tumor made from the cells that give you life, sperm and egg cells. Germ cells tumor most commonly occur in the ovaries and all testicles. The majority of testicles tumor start from germ cells. Less commonly, germ cells tumor may also appear in the brain, abdomen, and chest. Blastoma. Tumor are formed from embryonic tissue of developing cells are known as blastomas and are more common in children than adults. Examples include medulloblastoma and glioblastoma, types of brain tumor, retinoblastoma, a tumor in the retina of the ear, osteoblastoma, a type of the bone tumor, and neuroblastoma, a tumor of the nervous system found in children. Tnm classification, it's a very important classification. The Tnm classification are malignant tumors. Is a global recognized standard for classifying the extent of spread of cancer. It is a classification system of the anatomic extent of tumor cancers. It has gained while international acceptance for many solid tumors cancers, but is not applicable to leukemia and tumor of the central nervous system. Most common tumor have the one Tnm classifications. Tnm classification is a notation system that describes the stage of the cancer, which originated from the solid tumors using alphanumeric codes. T. What is a T? Describes the size of original tumor and whether it has invaded near tissue. N. Describe nearby regional lymph nodes that are involved. And M. Describe distance metastasis, spread of the cancer from one part of the body to another. T. The size, N. The lymph nodes, and M. Metastasis. Size of tumor can be different. And difference next type. TX tumor can be assessed. TX. T in situ, carcinomas in situ. T0, no evidence of the tumor, and T1, T2, T3, T4, size or extension of the primary tumors. The size. Now describes nearby regional lymph nodes that are involved. Two, we are different by NX. Lymph nodes can be assessed. N0, no regional lymph nodes metastasis. And N1 and 2 and 3, regional lymph node consist metastasis. And M, presence of distance metastasis. N0, no distance metastasis, M1 metastasis to distant organs beyond original lymph nodes. Student, and now we can see the stage of the cancer process. How to find out stage this process? If your patient have not evidence growth of the tumor, have not nodes with metastasis, have not distant metastasis, it's stage 1, stage 0. Stage 1 have the growth of the tumor, but in some case no metastasis on the nodulus, and no distant metastasis. But stage 1b have the growth of the tumor, the metastasis on the regional nodes, and no distant metastasis. Stage 2 have the growth, no, a small growth, and have the metastasis on the regional metastasis, node 2. Have not distance metastasis at stage, and now the first and second stage of the cancerous, it's treatment table cancerous treatment table. Stage 3 have the a large growth of the tumor, large growth. Now, for example, T2, T3, T4, and have the nodulus metastasis. Nodulus 2, nodulus 1 metastasis, but have not distance metastasis. It's stage 3. And stage 4 have the large growth of tumor, have the metastasis of the nodulus and lymphatic nodules, and have the distance metastasis. It's stage 4. Stage 4 is non-operable tumor, non-operable tumor. The stage 1, stage 2 is operable forms of tumor. Stage 4, non-operable tumor. Okay, student, today it's enough, and the final information for you on January and all information of this exam I post on your portal. I post information of date of exam, time of exam, and I post the information of question for exam. Okay, goodbye.